Hello, everyone. Thank you so much for joining us today. Today, we are talking about everything to do with poo and wee, stuff that comes out of your baby, which certainly, as a mum of two, I've seen everything come out of my babies, as I'm sure you have or will. So I would like to thank Dr. Deb Levy for joining me today. My name is Sarah Hunstead. I am a paediatric nurse, mum of two, and founder of CPR Kids. And what we do is empower parents and families with baby and child first aid and telling you all about child health information. Now, before we go any further, before Deb introduces herself, can you just give me a wave or a thumbs up just so I know that all the technology is working as it should be? And don't forget to tag anybody in the comments below who you think will benefit from this good evidence-based information. So, Deb, can you introduce yourself to everyone?
Thanks so much, Sarah, and it's great to be here. My name is Dr. Deb, and I'm a pediatrician. I have a unique holistic approach to children's health. And I'm also a mum of two girls. Mine are a bit younger than Sarah's. Mine are 4 and 6. And because it's 8 p.m. here in Toronto, Canada, where I'm talking from today, they're asleep, I hope. I know. I'm usually based in Sydney, and Sarah and I worked together quite a few years ago, and it's always wonderful to connect with her and her breadth of knowledge. So I think today is going to be a great chat. Thanks for having me.
No, I think so too. I don't know if it's a medical thing, but I love talking about poo and wee when it comes to kids because it's just so important. It's such a reflection of their overall health, and certainly some weird stuff can come out of them too. I remember when I took my oldest child to the beach, and she was a crawling toddler or crawling baby at that stage. And when we got home, I changed her nappy, and there was like this poo that was like long in the shape of poo, but it was 100% sand.
Yeah.
Yes. I was gobsmacked. I looked at this, I'm like, it's sand in the shape of a poo. That's just cleaned her inside out quite.
And I mean, in the toddler who's crawling around and mouthing everything because that's part of their development, that's entirely normal. If you have that in an older child who's eating soil, that's actually something called pica or pica, depending on which country you're from, and that could indicate iron deficiency. So you're 100% right that, the poop gives us a lot of clues.
It sure does, doesn't it? Excellent. Yeah. So Deb has got some fantastic graphics to help with our talk today. So I'm going to bring them up onto the screen. So Deb and I are going to be very small now on your screen while we have all of the graphics to go along to help us remember what you're going to tell us today, Deb. So let's go for it.
Okay, excellent. Let's just dive straight in. So as Sarah said, I'm going to be talking today about baby poop, baby pee, and if I have time, I'm also going to throw in a little bit about penises and vaginas. So I'm going to try and do everything in that nappy region. That's me. If you want to contact me, there's my email as well as my handle on social media.
Okay, excellent.
Next one.
There we go.
There you go. I've also created a really helpful free resource for parents of newborns or mums and dads to be. You're welcome to go and download that. There's the URL. Alternatively, again, you can find the link on my Instagram bio.
Yep, and make sure you go have a look at Deb's website because it's got some fantastic information on there, downloads and blogs that I've actually found quite helpful as well. So definitely go take a look at that. Oh, I love this.
Okay, sorry, we're jumping straight in.
No, I love it.
Right now. Okay, so I'm kind of just going to go through poop first, and I'm going to go through it from day one that your baby's born, and then looking at different things that can either be normal or things that can be abnormal. And I think it's really important to know the difference. Okay, so firstly, meconium. That is the first poop that your baby ever has. It's this dark green, thick, tarry, disgusting stuff that is the hardest poop to ever clean up. Exactly. It should be passed within the first 48 hours of your baby's life. If it isn't, then we need to look a little bit further in terms of, well, what's going on? Is their gut functioning properly? Sometimes babies will actually poop just at delivery or just before their delivery. And you may have heard of that. The term is MEC-stained liquor or meconium-stained liquor. And that can actually cause a problem if babies breathe it in. So we need to know about meconium in terms of it's normal. We need to see it happen, but at the right time. After that, after the first couple of days, like the first 24 hours, the second day, the poo then starts transitioning. And by that, I mean it starts to slowly go into your typical yellow, seeded mustard kind of poop that you get. Yes, there are a lot of food comparisons to poop. We can't help it. We'll just move ahead.
It's the easiest way.
I put a picture there because I wanted to illustrate something to you. So the poop that's closest to the writing, exactly, that is a normal breastfed baby's poop. So, I mean, I'm not sure how clearly you can see it, but it's kind of, you know, as I said, a bit grainy. It's got that yellow color, but it's a lot of liquid in there too. Mm-hmm. A formula-fed baby's poop is sometimes a little bit harder. I'm not talking pellets or anything like that, which would indicate constipation, but it's more like a toothpaste kind of consistency.
Yeah.
So just to tell you these subtle differences, bearing in mind that there's definitely a range of normal, and, you know, there's also a range within your baby from day to day. So it's important just to keep that in mind. But I will go into a little bit more detail about when to be more worried. But just to let you know that things change and things vary depending on what they're feeding, what you're eating if you're breastfeeding, etc. Okay, so yellow I've kind of covered in saying that that's the normal poop that young babies will have when they're on milk feeds. Green poop. I get a lot of worried parents saying, oh my goodness, my baby's poo's turned green, what's going on? And the answer is I don't usually worry about the color green because it can indicate a whole lot of things. One, it can just indicate, again, what's just been in their diet or your diet. It can indicate that they're getting a little bit too much lactose. So maybe mum's got a generous breast milk supply. And you may have heard of this lactase overload or lactose overload. Sorry, I'm confusing myself. Lactose overload if mum's got a lot of fore milk, and that can be remedied with seeing a lactation consultant who can help you. When I get a little bit more worried about it is if it's green and frothy. So I'm more concerned if it's frothy, and that's much more indicative of lactose intolerance. I'm happy to go into what that is. Pardon?
So it's the frothiness that really got it.
I'm happy to go into what that is. Alternatively, I've written quite a clear post on Instagram this past week where people can read a bit more about lactose intolerance. But the other clue about lactose intolerance I'll just mention now is that they often get a really bad nappy rash. And the reason being that the lactose, by the way, it's very different from cow's milk protein intolerance, which we will talk about a bit about today. The lactose is the sugar that's in milk, and it's an inability of the baby to adequately digest that sugar. So then it travels down the gut, becomes fermented and acidic, and that's when they get that really red, really angry looking nappy rash.
Yeah.
So yeah. So you see, you kind of get all these clues as you go, and I'm certainly not expecting parents to be, the doctor here, but I think it's important just to be aware of things and, take the pictures. So when you go into your doctor, it's much easier to describe things.
That's right. You wouldn't think it, but we actually love to see pictures of poo. I had $1 for every time sitting at triage that I had a parent come and just unwrap a nappy in front of me and go, look.
Oh, no, that's the worst.
Yeah, and we actually appreciate it. Sometimes the picture's better, but absolutely bringing in the nappy is okay too. We actually like to see it. It's a good thing.
I know. I always prefer the photos. Okay. So I've mentioned yellow, green, frothy, and the next point is white. White is always abnormal, and you always need to seek urgent care for white poo. The reason being that this is associated with significant liver conditions. It's all I'm going to say. It's incredibly rare, but you just need to be aware of it.
Yeah.
Runny poos, hard poos. I feel a bit like Goldilocks and the Three Bears in the forest. So again, there's a variety. The runny poos, I'm sure that every one of us who have had young children already remember those punamis where they're all up the back, and it always happens at the worst time.
In the car seat.
In the car. Oh no, thank God I never had that. Oh, that's bad. So it doesn't always mean that something is going wrong. The clue to me would be if it's a persistent problem. So one of those poos every now and then, entirely within the realms of normal. But if it's persistent, large volumes, very watery poo, I would be more worried. Okay.
Yeah. And I think a key here too is different to normal as well. So you know what is normal for your child. So if it is different to what they normally have, that's a red flag as well to you to go, oh, hang on a sec. Have I fed them something new? Have I done something differently? Or do I not know what this has got to do with?
Yeah, exactly. The hard is around constipation. So that in itself is a very long conversation to be had as a separate talk. I see that someone has already asked, and we'll probably come to questions a little bit later on. So, Kat, we will address your question a little bit later about hard poops. But essentially, the question again is this persistent? Is this just a one-off and the next poo is normal, then I wouldn't worry about it? Is this persistent? Is your child grunting and straining more than normal? P.S. It is normal for young babies to grunt and strain when they poop. They're getting used to doing it, and their musculature, their bodies, they're getting used to it. So if it's different, if they seem to be in pain, when they're passing it, then I would be much more worried. Yeah. The bits of food, again, can be entirely normal. And that's obviously for older babies. Sorry, I don't mean bits of mum's food. So that's older babies, but I just wanted to throw it in here because when you start solids, that's what you're going to see. Okay.
I think it's really important that we do quickly mention here, because this is a question that we get in our classes all the time, and I've had this of people coming into ED as well, worried about it, is when people bring in a nappy and they've just introduced banana for the first time. And when you introduce banana for the first time, when they poo, it can look like tiny little red or brown worms throughout their poo. This is just banana fibers. CPR Kids has actually done a post on this, on banana fiber poo. Go back through our socials, go to our website, our blog, because we have had an overwhelming amount of questions about it. Because, if you don't know, you don't know. You just open up your child's nappy and it looks like it's full of worms, but it's actually banana fibers. So have a think.
That's a great one, Sarah. Thanks for mentioning that. Yeah. I think you should share that in your IG stories tomorrow.
Yeah, I will actually. I will. Okay. I'll post some banana.
Yeah. Okay. Let's go to the next slide, because I think that we need to touch on that. And as I've said, the poo closest to the writing, that's the normal poo. The next poo we're going to talk about on the next slide.
Okay, we'll talk about that next.
Okay. So the big one, the blood and the mucus one.
Yep.
And I see there's already a question there, so hopefully we will address it as we go. So mucus, I'm going to address that first. Mucus can be caused from a few things. Mm-hmm. The one that we are possibly more concerned with is cow's milk protein intolerance, inflammation of the gut. That usually, those kind of poos are usually they also usually have blood in them. Okay. Babies, again, these aren't newborn babies, but babies a little bit older who are teething, or even babies who have a cold, they can also have mucus in their poo. The clue that there's mucus is that it literally looks like snot. So it's shiny, it's slimy, and sometimes you can even get globs of snot. Yeah, exactly. Yep. The nappy or diaper, wherever you're listening to this from, the far side, if you look closely, you can see the difference between the normal one and the one with some mucus and blood. So exactly, Sarah's circling it there. So you can see straight away, it looks more shiny. There are little flecks of blood in. It's incredibly unusual to get large amounts of blood. This is the kind of blood that we're looking for. That being said, of course, again, there's a degree of what you can find, of severity. Yep. So by far, the most common cause that I'll see in my practice of blood and mucus in the poo for young babies is cow's milk protein intolerance. It's very common, and thankfully it's usually pretty easy to treat, and it's just taking milk out of either mum's milk and soy out of either mum's diet if she's breastfeeding, or changing the formula to what we call an elemental or a broken down formula, so that the baby then doesn't recognize the milk protein in the formula. I'm not going to go into that in great detail, other than to point out these are the big clues. Babies may be a bit uncomfortable, they may be totally fine. So again, a big range. Often babies with this may also have some symptoms of reflux. So just to flag that to you. I'm not sure. There's nothing else that I think I could add around that. Obviously, the older children, blood and mucus in the poo does mean different things. I think I'll probably just keep it to newborns for this talk, because the difference with older children is when you're getting blood in the poo. Actually, no, I think I'll talk a little bit about it. The other issue with blood in the poo, other than this, so if you look at this blood, it's red, it's bright red. The other kind of blood that you can get in poo is what we call altered blood, digested blood. And that is when babies have either had some bleeding higher up in their guts, or maybe in their stomach, or they've swallowed blood, i.e. through mum's cracked nipples or breast milk. And then babies' poos can actually become very, very dark, very smelly, almost...
It's completely
disgusting. It's called melena. And for those of us medicos who've smelt it, you never forget that smell. But again, this is a very unusual condition in such young babies. So just to let you know about that. And obviously, again, with babies who are severely constipated, they can have little tears in their anus, and that again can cause a little bit of fresh blood in the poo. So those are the kind of things that we're looking for when there's blood.
I think the important thing, if you do see blood, if there's a little bit in there, your baby's otherwise well, feeding well, all of those sorts of things, then that you still need to have a trip to the GP just for them to look at it. However, if your child is looking unwell, they're not feeding well, they, perhaps they're even pale or floppy, things like that, and they have a nappy that is just full of blood, that's a medical emergency, and you do need to be going to the emergency department with that.
Yeah,
so
exactly.
Looking at your child as a whole as well. So I think that's a very important thing. And take that nappy with you.
Exactly. Or a photo. No, they might want us to take a sample. You're right. You're absolutely right. Take the nappy with you. Because, it gets the other point in terms of a sample, these things can also be caused by infections. It's just unusual in young babies, which is why I haven't mentioned it yet. The most common would be the cow's milk protein.
But at the end of the day, you don't need to diagnose that. No. That is up to the doctor. So it's just being aware of what to look for and then going and seeking the appropriate help.
Thanks, Sarah.
Yeah.
Okay. So on to P. I think for newborns,
before you go on, Deb, we will get to your questions as well when we're at the end. So I noticed there's lots of questions coming up.
Yeah, no, I'm seeing them coming through as well. And that's why we'll finish the talk and then we'll time on questions. So in terms of P, so urination, micturition, the formal words, what we're looking at here is wet nappies and how many and how heavy. And I think it's really important for parents to know what's normal, so then you know what's abnormal. The rule of thumb that I use is that on day 1 of life, you can expect 1, on day 2, 2, day 3, 3, up until about a week old, and from that point on, it should be 6 to 8 nappies every 24-hour period. Would you agree with that, Sarah?
Definitely.
Yeah. And so how much were they doing? Newborn babies obviously don't have a big volume, but and that's why those disposables with the stripe that changes color can be quite helpful, because when you feel it, it's not that heavy anyway. But otherwise, you're just feeling the weight of it.
Mm-hmm. Yep.
The 2 points I want to make is I've shown a picture here of what very much looks like blood, but it's not. So it's very common for newborn babies who haven't caught up with their fluid intake yet, i.e. mum's breast milk hasn't come in yet to have something called urate crystals that looks exactly like blood. Do not worry about it. Absolutely speak to your healthcare provider. But as milk comes in, this will resolve. It doesn't indicate anything underlying. The smell, what I'm referring to is clues that there could be a urinary tract infection. So little babies with urinary tract infections don't put their hand up and ask to go to the toilet 100 times or tell you that it hurts when they pee. They either just vomit, nothing else, just have a fever, maybe vomit and have a fever, and that's it. So it's very hard. So it's usually routine if we see a young baby to check their urine, and we being, medical profession, hospitals, GP, whoever you go and see, but also sometimes there's that bad smell. So that's just something to be aware of.
Yep. And that's why if you do go to the hospital, certainly if when your child has a fever, we will ask you to catch a urine just to exclude that, because it is quite common. So that's an important thing. When we don't do it for fun, there's good reason for it.
Yeah, exactly. Okay.
Oh, I'm not being very fast with my job today, Deb.
Okay. So, Sarah, do you think we should talk about boys and girls bits, or should we go on to answering questions?
Let me see. Why don't we have a really quick overview? But you know what I think? I think we should do a full Facebook Live on genitalia. That sounds terrible, doesn't it? But that's exactly.
I was worried that Facebook or social media would stop it. Was that, you know what I mean? They pick up some weird things.
Yeah, I actually did a Facebook Live in probably the second half of last year, all about boys' penises and testicles and all of the different things around it. It was incredibly popular. I think we should just do that again. That's what I think. I reckon we should do it together. So why don't we go to the questions?
Yeah. There's another slide that I will bring up, and then when that's up, we can answer the questions, because it's the alerts around the poo and the pee.
Excellent.
Because I see the questions. I mean, unless someone wants to object strongly and they want to hear about girl and boy things, I'm happy for you to ask your questions in the comment section, and I can always spend some time on that too. So these are my red flags when it comes to poop, pee, and genitalia, and it's actually just boys. I'm not being sexist. And just to point out something that Sarah also highlighted a little bit earlier, it's also the general demeanor of your child. I'm not touching on that at all. I'm specifically talking about their poop and their pee here separately. So when I would be more worried is poop with blood or mucus, poop that's white, as I mentioned, profuse, frothy, and then a significant diaper rash. Mm-hmm. With it's infrequent or light nappies and very smelly. And then boys, we won't talk about now. So those are my red flags, other than a child who's not thriving, not feeding properly, doesn't look well, etc. But just looking at those things. And I guess the point around that is, how urgently do you as a parent need to seek care for your child?
Yeah, exactly.
Yeah.
So I think you've highlighted that really well there. And, and thinking about, is it different to normal? And that's really, really important. Yeah. Okay, let me bring some of these questions up. Mm-hmm. So, first of all, MJ has said, is the presence of blood in the poop may indicate bowel obstruction? Would you like to shed some light on that one?
It would be incredibly unusual. That being said, if you have a child who's had previous surgery, gastrointestinal surgery, that obviously would become more likely. The bowel obstruction that we would often see with blood in the poo is something called intussusception, and that's often with older children, so not newborns. With babies with bowel obstruction, you'll often get something called a volvulus, which is when you get gut twisting, and you don't normally see blood in the poo. So that would not be my first thought, that there was bowel obstruction.
Okay. Thank you, Deb. Excellent. All right, so next one, we've got Kat asking a question here.
One went above it.
Yep, so Kat has,
two, sorry, my mistake.
So Kat has been asking that her daughter grunts a bit, tries to push it out. She's also mentioned in an earlier question as well that she is bottle fed and breastfed as well. So it seems to me that Kat's daughter's poos keep changing all the time. So what do you think about this, Deb? So she's breast and bottle fed.
Okay. So obviously the point here is, can your daughter be constipated? You know, the general rule is that exclusively breastfed babies don't get constipated, while formula-fed babies are at much higher risk. So is there a chance that your baby could have some mild constipation? It sounds like it just by those hardballs. But it would all depend to me on how much she's having, how frequently she's having it, and then what formula you're giving her. So new comments on this here. She's commenting on that. So your question, I'm just trying to work out what your question is.
Okay, so I think from reading Kat's questions is, you know, is this normal? So,
so that's normal. Yeah. The nuggets of I would be, if you told me that she grunts, I wouldn't worry. I guess it's those nugget poos. If you're describing, you know, like a proper like rabbit pellet that's hard, then I would be more suspicious. So I would potentially. I guess I'm not one to change formulas very quickly, but I would certainly go and speak to your healthcare provider about considering that maybe that formula that she's on is causing some constipation.
Yeah, Kat's actually said it's S26 that she's on.
Standard, yeah. I would probably rethink that formula and see if it helps. But what I don't want you to do is swap and switch the formulas, because that can also cause problems. You know, they're the comfort formulas that are supposed to be a bit better. They're the goat's milk formulas that are supposed to be a bit easier to digest. You know, the good thing about formulas in Australia is that nutritionally they're all comparable. They have to be by legislation, if that's the right word. But that would be kind of my thought there as to whether or not that formula is just starting to make her a little bit constipated. So, yeah, hopefully that helps.
So I think the important thing is that, as Deb said, that, you know, go and have a chat with your health professional as well about these things. So I think Deb's given you some good advice on, you know, that you may need to actually go and see them. So then we've got Ricky Lee. So what Ricky Lee has said is that her daughter has had continual mucusy and some blood in her daughter's stools, that after introducing soy and so on, that the blood is gone, but however, mucusy poops are still happening. Her paediatrician isn't too worried, and Ricky's question is, are mucusy poos an issue alone? Okay, so is that an issue? And I'll just hide that question there again, just so that, you can still see us while we have a chat here. So still mucusy poo, but no blood. Any suggestions?
The issue, obviously, and you're aware of, is that there's big cross-reactivity. So a lot of babies who are sensitive to dairy will be sensitive to soy. And to me, it sounds like your baby is still reacting to the soy. You know, I'm not going to step on your pediatrician's toes. And I think that this is a discussion you should have with them. But I don't know whether it would be worthwhile reconsidering and starting on the milk ladder or the soy ladder after a period again of abstinence of them. But that, you know, yeah, I mean, I guess I don't like for babies to have mucus in their poo, you know, unless you tell me, oh, you know, she also started daycare and she's had snotty nose after snotty nose. And then we can go, well, then it's from that. But I would think it would be worthwhile rethinking how you introduce. But it is important to introduce these foods, because the longer we keep them out of your child's diet, the more likely they are to have a different type of allergic reaction, which is more of your typical, you know, your hives, your anaphylaxis. So, you know, it is important to get these foods into your child's diet, but I wonder if their system's just not quite ready yet, just because they've got this ongoing mucus. So I would have the discussion again with your pediatrician and just question whether or not a period off, and then starting again on that soy ladder and the milk ladder, which you're probably familiar with as well. And there's a lot of information on the Askia website, and I think that might be quite a good resource for you.
Absolutely. And we can put a link to that in the comments below as well. So, yeah, we can pop that in there too.
Yeah.
So hopefully that will be helpful. And just thank you, everybody who's been asking questions. Obviously, Deb can't give you a private consult over the interwebs, but she can help guide you as to where you can seek help and what you need to seek help about. So just, being a bit clear about that as well, I think is important, because unfortunately, you tend to need a bub in front of you to be able to do a proper assessment on them rather than just some words on the screen. So thank you for your understanding.
The other thing I just wanted to, sorry, Sarah, I just wanted to add in just a point that I think we can all learn from, some of the experiences that the mums have thankfully shared with us today with their babies, is it can take a long time for things to settle, especially with cow's milk protein intolerance. It's certainly not overnight, and my usual is 4 to 6 weeks, sometimes 3 months, that it'll take for babies to settle down, for their guts to settle down. And often I end up taking more things out of mum's diets as well, but I do that very, very cautiously. I do that with the guidance of a dietitian, because what we don't want is for you, mum, to become nutritionally deficient. But just to let you know that, this is sometimes a bit of a journey that you're starting on. But the good news is that the vast majority of children all outgrow it with no consequences.
And that's a good thing.
Yeah.
That is definitely a good thing. So we will be back again next week, same time, same place, broadcasting out to the Baby to Toddler Show, CPR Kids, and Dr. Deb's pages. And we are going to be talking about the big one.
Yeah, the unsettled baby and reflux.
Yes. Oh, so what I would love you to do is we will actually put this event out, make sure on our pages, so that you can actually, what's the word? What do? You click interested or going? I don't know. That's what you do on Facebook. You click that. It will send you a reminder that we're about to do this. Please tag anyone in it who you think will benefit, because reflux is something that is talked about all the time. I think that there is, a lot of kids diagnosed with this, whether it's right or wrong, but I'm sure Deb is just going to blow some myths out of the water, give some really good evidence-based information, and really talk about that unsettled child and what it
means. With exactly 100%. Reflux, silent reflux, colic, 100%.
All of that. Yep, that big umbrella. So that will be a fantastic talk that I'm really looking forward to. And remember, please share this information around. It's good evidence-based information. It is why we are here, is so you can just filter all of that other crap that comes off Google. So that's right. There's some great information out there. We will help you to find it. So we will pop down below in the comments the links to ASCIA, which is the Australian Society of Clinical Immunology and Allergy, and hopefully that will have some good resources for you. Thank you again. We will see you next week, and thank you again, Dr. Deb, for your sage advice.
Thank you, and thanks everyone for listening. Bye.